Nintedanib in progressive fibrosing interstitial lung disease. Definitions. Nintedanib is an intracellular inhibitor of tyrosine kinase. It inhibits processes involved in the progression of lung fibrosis. Pulmonary fibrosis is a chronic and progressive lung disease where the air sacs in the lungs, called the alveoli, become scarred and stiff, making it difficult to breathe and get enough oxygen into the bloodstream.
Number 8. New medications for idiopathic pulmonary fibrosis.
The lungs are the only internal organs that are exposed to the external environment and are vulnerable to a variety of ailments. However, when it comes to idiopathic pulmonary fibrosis, or IPF, death is a certainty unless the lungs are replaced. Idiopathic pulmonary fibrosis is a progressive disease isolated to the lung that causes scarring, thickening, and damage to lung tissue. Currently, more than 80,000 American adults have idiopathic pulmonary fibrosis, and more than 30,000 new cases are diagnosed annually. Life expectancy after diagnosis is usually 3 to 5 years, with patients progressively getting worse, most often because of respiratory failure. There is a new hope for patients with IPF. 2 experimental drugs that have been proven in large international studies to significantly slow the progress of IPF were just approved this month by the FDA. 2 new drugs in 1 year. People with IPF will finally be able to breathe easier.
So pulmonary fibrosis is a type of interstitial lung disease, and basically pulmonary meaning lungs and fibrosis meaning scarring. So pulmonary fibrosis is a progressive scarring disease of the lungs. Patients with pulmonary fibrosis can present in a very nonspecific manner. They can present with shortness of breath, with usually dry cough, sometimes fatigue, tiredness, and oftentimes they'll present to their primary care physicians or even to their cardiologists. And people may think, well, this is a heart condition, or they'll write it off as being old age, deconditioning, being overweight, and they won't seek the attention of a pulmonologist or have a pulmonary evaluation until further on into the disease than they realize. So for idiopathic pulmonary fibrosis in particular, we use history and physical exam detailed, looking at past exposures, other comorbid conditions that they may have that can interact with the lungs. And we rely heavily on imaging, so high-resolution CT scanning gives a lot of detail about the lung tissue and the pattern of lung injury, and we can sometimes diagnose IPF on the basis of the combination of those things with the high-resolution CT scan. So for IPF, there is no cure, and in the United States, there's no FDA-approved therapies. For those patients, I encourage them to look into research, clinical trial options, and we have some of those available here at our practice. Other things that we sometimes do to help with the disease is management of symptoms like cough and shortness of breath. We prescribe supplemental oxygen when that's appropriate to try and help them maximize what they're able to do. Physical therapy through a pulmonary rehabilitation program is very important and can actually really help to improve the quality of life and level of shortness of breath that people experience. I also encourage involvement in support groups with lots of education and reaching out to other people that have similar conditions. When I'm talking to patients, we have to understand the limitations of our current medical therapies, and that's important. But then the other thing I always focus on is what can we do to help a person? Education is very empowering. Reaching out to groups like support groups for pulmonary fibrosis and meeting other people, learning more about their disease and disease management. Symptom management is always important, and being involved in knowing what's out there in terms of new therapies that are on the horizon and potentially contributing to that knowledge by participating in research therapies as well.
Applications in medicine. It's important to know about the symptom signs and the new treatment for this disease. In case of Nintedanib, The efficacy of this drug has been shown in idiopathic pulmonary fibrosis.
In this video, we'll be discussing Nintedanib, a drug used for the treatment and management of idiopathic pulmonary fibrosis, or IPF. Pronounced Nintedanib, this drug was approved for prescription by the Food and Drug Administration in 2014 and Health Canada in 2015. Using inhibitory intracellular mechanisms, Nintedanib targets tyrosine kinases to help decrease the overall decline in forced vital capacity, which is an important criteria in determining the progression of IPF. The drug targets the receptors of fibroblast growth factor, or FGF, platelet-derived growth factor, or PDGF, and vascular endothelial growth factor, or VEGF. These growth factors play an important role in the pathogenesis of the disease, and more information regarding their role can be found in the video description below. By targeting the receptors, Nintedanib inhibits the activation of these growth factors, thus slowing the progression of IPF. A recent set of studies published in May 2014 in the New England Journal of Medicine studied the effectiveness of Nintedanib in treating IPF. Performed in 24 countries with over 1,000 patients, these studies were conducted by the same group of researchers and were set up as random, double-blind, and placebo-controlled Phase 3 clinical trials. The drug-administered group of patients who was given a dose of 150 milligrams of Nintedanib twice a day for 52 weeks, and the control group was given a placebo twice a day for the same amount of time. The overall effects of Nintedanib showed a significant decrease in the decline of FVC in patients who were given the drug. Patients who received the drug saw an average difference of 109.5 milliliters per year in their forced vital capacity versus patients who were on placebo. In addition, the only observed side effects of Nintedanib were frequent gastrointestinal issues, with most patients reporting mild cases of diarrhea. For more information regarding these studies, please check the video description. This concludes this short video on Nintedanib. For more videos like this, please subscribe to the McMaster Demystifying Medicine series channel.
Pros and cons. Pros. In the overall population, the adjust rate of decline in the FVC was 80.8 ml per year with Nintedanib and 187.8 ml per year with placebo, for a between group difference of 107.0 ml per year. Cons. Although the efficacy of Nintedanib has been shown in idiopathic pulmonary fibrosis, its efficacy across a broad range of fibrosing lung disease is unknown. Issue apply in Ecuador. In Ecuador, it's important to know about this disease, how to diagnose it, and what are the multiple treatments for this disease.
The hallmark symptom or main symptom of IPF is shortness of breath. It comes on very quietly or gradually typically. It sneaks up on patients so that they notice shortness of breath maybe when they're walking up a slight incline that they once walked up without any difficulty. Other symptoms include a dry, hacking cough, and fatigue is a really under-recognized symptom by the medical community. It's very common in patients with IPF. We once thought idiopathic pulmonary fibrosis was extremely rare, but we're finding out that it's actually much more common than we once thought. Primarily due to improved technology, namely high-resolution CT scan, we're identifying abnormalities in the lung and thus the diagnosis of IPF much more frequently.
Conclusion. In patients with progressive fibrosing interstitial lung disease, the annual rate of decline in the FVC was significantly lower among patients who received Nintedanib than among those who received placebo. Diarrhea was a common adverse event.
INBUILT study is a very important study that was presented at the European Respiratory Society meeting in Madrid in September of 2019. What the INBUILT study looked at was the use of Nintedanib in patients with progressive fibrosing interstitial pneumonias, or interstitial lung disease rather, beyond IPF. So it included a somewhat heterogeneous group of patients, including those with NSIP, unclassifiable chronic hypersensitivity pneumonitis, so a broad group of patients with progressive fibrosing lung disease. One of the important inclusion criteria, as I recall, was that patients had to have more than 10% fibrosis on their HRCT, and the primary endpoint at 52 weeks was change in the FVC. This study was unequivocally positive, with a large difference in terms of the treatment arm, patients on Nintedanib versus patients on placebo, with, as I recall, a more than 100 cc difference in the change in FVC, which really is quite a remarkable difference and perhaps beyond the expectations going into the study of what we might see. What this means for the practicing clinician is that if the drug is granted approval for these progressive fibrosing interstitial lung disease, we'll have many more patients that we can offer Nintedanib to. This also kind of raises a question of where are we with the classification of the ILDs, because if you want to be more of a lumper rather than a splitter, you might say, well, why should I differentiate IPF from NSIP, from non-classifiable, from chronic HP, if I'm going to just treat them the same? So this has kind of opened up a little bit of a black box in terms of where do we go with the classification of ILDs. Personally, I believe it's still very important to do our best and due diligence to make the correct diagnosis before we decide which therapy to go on. But I think this is good news for patients and for clinicians as well in terms of options that we have to offer these patients.